Mr. President, we just heard a very eloquent speech given by the Republican leader here in the Senate about the history of the Senate, the role that it's played in our democracy, its past, and what could be its future if we can restore it to where it once was. The leader talked a lot about things that used to be taken for granted around here, the committee process working and functioning, where committees actually reported legislation out, worked on it, brought it to the floor, an amendment process where when legislation got to the floor it could actually be debated, amendments offered, amendments voted on, individual senators having the opportunity to offer amendments, and to be the voices that our people elect us to be here in the United States Senate. And unfortunately, in many respects, the current Senate, the wheels have come off. We find ourselves with a process there. Typically, the amendment tree is filled, which blocks amendments from being offered, and perhaps the best factoid with regard to that is that there have only been 4 Republican amendments voted on since July. A half a year in the United States Senate. 4 Republican amendments voted on in the United States Senate. Now, in any institution where you have any form of open debate and open amendment process, you're going to have a lot more votes than that. And I think that's very telling about where we are. I was here as a young staffer back in 1985 and 1986. At that time, Senator Bob Dole was the majority leader in the United States Senate. It was a very different place. The boss I worked for, I worked on some issues for him, and he had his opportunities, as did other senators at that time, to come down here in the Senate, offer amendments, to be able to speak out on behalf of his constituents on issues that were important to them, important to him. And that's something that has become a bygone era. And I also had the opportunity prior to being elected to the Senate to serve in the other body, the House of Representatives, where things are very structured. You have a Rules Committee that basically regulates what legislation comes to the floor, what amendments will be made in order, how much time is allowed for debate on each amendment. That is the way that institution was structured. The Senate, as Senator McConnell, the Republican leader, pointed out earlier, is a very different institution by design. Our founders wanted it to be different. And Senator Alexander, in his remarks, talked about an author who described it as a touch of authentic genius. The United States Senate. We've gotten very far away from that in terms of its historic role and certainly what should be its role today as we debate major policy, major legislation that impacts over 300 million Americans. And so, Mr. President, today I come to the floor to discuss an issue that was debated here a few years ago, which is an example, a byproduct, if you will, of a one-party rule where a big piece of legislation is jammed through in a partisan way, and that's Obamacare. Now, my colleagues on the Democrat side recently have spent a lot of time talking about income inequality. And after 5 years of stagnation in the Obama economy and an ever-growing gap between rich and poor, I think it's high time for us to be talking about that. But part of that discussion, a critical part that Democrats don't want to have, has to be the ways in which Obamacare is contributing to the problem. As the last few months have made clear, Obamacare is making things worse for millions of Americans. Huge premium increases and soaring out-of-pocket costs mean that families will have to take money that they would have used to buy their first home or pay for a child's college and use it to pay for health care instead. Crippling mandates on employers mean fewer jobs available for the unemployed and reduced hours for workers. And as if the economic problems caused by the law weren't enough, recent weeks have made clear that the quality of care is likely to diminish thanks to the President's health care law. Contrary to the President's promise that you could keep the doctor that you had and liked, millions of Americans are discovering that they will be losing their doctors this year and that their choice of replacement is limited. Why? Well, because Obamacare provides an incentive for insurers to limit the pool of doctors, and I might add hospitals as well, that you can visit. The President's health care law placed a number of new burdens on insurers, from new taxes to a new requirement that everyone with pre-existing conditions be covered at the same rate as healthy individuals. On top of that, the law gives states the authority to tell insurance companies how much they're allowed to charge for their health plans. As a result, insurance companies are facing huge new cost increases with very few ways to cover those costs. So many companies have chosen the one cost control measure still available to them, and that's limiting their networks of doctors and hospitals. In California, for example, as a Time magazine article recently reported, Blue Shield offered doctors a choice: be reimbursed up to 30% less for medical care or be excluded from the network. The Time article, which was entitled "Keeping Your Doctor Under Obamacare is No Easy Feat," goes on to report, and I quote, that among the providers who declined to accept the lower rates were some of the state's most prestigious and expensive hospitals, including Cedars-Sinai Medical Center in Los Angeles and hospitals affiliated with the University of California, end quote. There's a reason these hospitals are prestigious and expensive. They are on the cutting edge of medical research and offering breakthrough treatments that are unavailable at many other hospitals. People come to these hospitals when other treatments have failed, and they often find hope. But these kinds of hospitals, world-class, cutting-edge facilities, are the hospitals most likely to be excluded from exchange plans. Time reports, and again I quote, a December 13th McKinsey study of 20 U.S. metropolitan areas found that 2/3 of ACA plans analyzed had narrow or ultra-narrow networks, with at least 30% of top hospitals excluded for coverage, end quote. The consequences of these narrow or ultra-narrow networks are many. First, of course, these networks may not include your doctor. If you've been forced off your health plan into a new private plan or exchange plan, your new plan may not cover the doctor you've been seeing for years, the doctor you like and who knows your medical history. This is detrimental to any patient, but for someone who is being treated for a serious illness, this could be devastating. Switching doctors midstream while being treated for cancer or other serious illness could have a disastrous impact on the quality of the care the patient receives. In addition to losing the doctor that you have and like, these narrow networks also mean that your choice of a replacement will be limited, at times severely limited, and that the same quality of care may simply not be available in the new network. Still, another consequence, as Time points out, is the distance that you may have to travel to get to your doctor or hospital. Excluding hospitals from an insurance network may not present a huge travel problem for urban residents, the article notes, but residents in rural areas may be forced to drive a long way to reach a hospital in their network. Time quotes Kaiser Family Foundation senior fellow Karen Politz, who notes that exchange customers in central Maine have to travel as far as Portland to reach a covered hospital. That could be a 2.5-hour drive. Not exactly ideal if you're, say, having a baby or a serious health crisis. But let's suppose that you do somehow find an affordable plan on the exchanges that does cover your doctor. You still may not be able to get care. A recent Fox News article focused on experts' warnings that the health exchange system may start to look a lot like Medicaid, the federal health insurance program for the poor. Like the exchanges, Medicaid features narrow provider networks, as many doctors either refuse Medicare patients altogether or limit the number that they see because of Medicaid's low reimbursements. So what is the result? Medicaid patients generally face worse outcomes than patients with private insurance. They wait longer for doctors when they can get in to see them at all. A survey published in the New England Journal of Medicine found that 66% of children on Medicaid were denied appointments with specialists, compared to just 11% of children covered by private insurance. Patients on Medicaid are more likely to suffer complications and spend longer in the hospital. And they are more likely to die from cancer, surgical complications, and other problems. Unfortunately, this could soon be the future of those forced into narrow networks on the exchanges. Patients will be denied access to top doctors and hospitals and will be forced to compete with other patients for access to a limited number of healthcare providers. Even those Americans whose plans cover their preferred doctors will not necessarily be able to get in to see their doctor if he's forced to start limiting the number of exchange patients that he takes. Analysts, Fox News warns, and I quote again, emphasize that having health insurance won't necessarily translate into access to health care, end quote. Now let me repeat that, Mr. President. Analysts emphasized that having health insurance won't necessarily translate into access to health care. This is what the grand promise of Obamacare has come to. Even those who have managed to make their way through the broken exchange websites and find an affordable plan still may not be able to get health care. Is this the rosy future that we were promised? Obamacare was supposed to fix our health care system. The President promised that it would reduce costs and expand access to care. Every American was supposed to benefit. Instead, millions of Americans have lost their plans. Health insurance costs have soared. There are parents who now can't afford to insure their children, and cancer patients who are losing their doctors and hospitals. Those few who have gained coverage are facing a system well on its way to becoming a copy of Medicaid. Mr. President, surely we can do better than this. We have got to do better than this. It is time to abandon the failed Obamacare experiment and move on to real health care reform. Mr. President, we can do that. We should do that. I yield the floor.